Hey everyone, Mike and Aubrey here from Simplify Abroad, and for this week's video, we had another request actually for healthcare in Spain. And so any Europeans, anyone pretty much not American watching this, please don't laugh at us too much. Obviously, we're in shock being from America and our health system versus what you get here in Spain. So again, if you're new to this video channel, first one you're seeing, like, subscribe. It helps boost the video a little bit, helps us, keep kind of doing these videos for everyone. If you have any videos you want done, please comment below. We'll try and get it done just like we did this one. But healthcare in Spain, I will kind of let my wife start off with this.
Yeah, so before moving here and before applying for your visa, you have to pay for a full year in advance coming from the United States.
Yep.
I don't know what it's like coming from other places around the world, but for our visa requirement, you have to have it paid for the whole year.
Yep.
And so for our family of 6 was, I think, $2,800 for the whole year, and that includes everything.
Yep.
And we do get 15, they call it acts here, and that could be anywhere. Like if you had a procedure done and you were in the hospital for weeks, a couple weeks, that is only one act, because it's like just one actual stay, and each person in our family gets 15 of those. And I know that like for children, like their annual checkups, that's completely free anyways. That does not count towards your 15. So I mean that's a lot. I mean last year I used, I don't think any, maybe one for in-ear infection. I mean he used a few. The kids tops 5 max per person. And that was like anytime they said, oh, I don't feel well, I'm like, all right, we're going to the doctor. Like you don't have to think about it like you did in the United States. You're like, are you sure? Is this something that we go to the doctor for? Because we didn't want to pay hundreds of dollars every time we went to the doctor.
All I can say, just to add to that, we did get our renewal, so we're now here for another 2 years. My mom looks like she's going to move to Spain as well. We got a quote to add her onto us. She is 65, 66. I don't remember what she is.
She's about to be 65.
There you go. She was $1,200 by herself. Our family of 6. I think I'm the oldest. I'm 35, 36, something like that. Everyone else is younger, obviously. We were $2,800. My mom was $1,200 by herself, but that, I mean, she gets the same 15 acts, right? Like that's insane to me. I don't want to give our exact number, but I can tell you we were almost paying more a month. Well, I'm sorry, we got quoted more a month if we were going to be at this if we didn't move to Spain than what we pay annually for our entire family, and we're going to pay that monthly in the States and have to pay deductible, co-pays,
everything.
All that type of stuff. So I want to touch on a story real quick because I actually use the healthcare here. I got appendicitis randomly, and it was funny because it was probably like 6 months into our stay here, maybe 7 months, and I was still like, my side was sore for a couple of days, and we were literally like, no, it's okay. I'm like, I'm not that bad. I'll just take ibuprofen. But like how Aubrey kind of mentioned, like that mentality, like shit, I don't want to pay for this, right? Basically. And so finally I couldn't take it one day. I was like going delirious. Aubrey took me into the ER, and they took a CAT scan, MRI. They did something right away, and they're like, hey, your stuff is inflamed. You got to stay here. I stayed 5 or 6 days. I got CAT scans, MRIs, x-rays, IV, food. I had a massive suite. This hotel room, this hospital room, it felt like a hotel room. The hospital room was bigger than our master bedroom. Had couches, it had beds, like it had a desk to like do work. Like our kids would hang out there, draw. I was there 5 or 6 days. Every scan imaginable. They actually gave me a ton of medicine, so it was something weird I didn't know. I thought they were just going to give me surgery and cut it out of me. Here they actually treat you with antibiotics or inflammation medicine first, and if it doesn't go down after 4 or 5 days, then they cut it out of you. But I guess with most people, if you just treat it with something, it does. Maybe the US does this now. I have no idea. I thought they were just going to cut me open and yank it out. And to wrap this story up, I was there 5 or 6 days, emergency room visit, MRI, CAT scan, all those things I mentioned before. I just want to keep saying those things because if you're from America, you understand what that costs.
Yes, and you don't get them.
And you don't, straight up, And when it was time for me to leave, they're like, all right, you're good to go. They took out my IVs, everything. Yeah. I was like, oh, like, do you need my billing address or anything? They're like, no. I was like, do you need my TA card, which is basically like a driver's license, my passport? Yeah. I said, do you need anything from me? They're like, no, like, we got your insurance card already. Like, you're completely free to go. Yeah. I was like, phone number, like I literally kept asking them because I felt like they were gonna come after me. You know what I mean? Like I felt like I was somehow stealing from them, and the police were gonna come knock on my door, like how you like dine and dash almost. And they're like, you are completely free to go. You owe nothing. My private insurance didn't bill me anything. They're like, and if you have any pain, just call an ambulance next time and have them bring you to us, and we'll just cut it out. That was like their thing. Like if you feel pain in 2 weeks, the antibiotics didn't take perfectly, call an ambulance, bring it to it, we'll cut out. And I cannot tell you the crazy rude awakening. I don't even know the word to describe it, that me and Aubrey were like, how do you even describe it? We were just blown away that it cost nothing. Like,
I don't know the word for it. It was pretty incredible.
Yeah. It was just disbelief. I don't know the word. Like I felt like I did something wrong. Like I can't describe to you more that like I thought that we're gonna get a bill. I thought the cops are gonna come knocking. Like, hey, you're supposed to pay this. Like, I don't know. Yeah. Never once got a call. The hospital never called me. I can't describe. Like, they never followed up. They never said like, oh, you have this bill. Like, nothing. Just I walked out the door. Yeah. And it was done. So. That's my story on it. I probably used six stays. That entire stay, the ER and the whole 5 days, 6 days, that was one stay. Just to keep that clear. So I'm sorry, I rambled for a bit, but I had to share that story because it's just so different than the United States. So sorry, go ahead.
Yeah, and then with your the insurance that you purchased, most likely you'll get an insurance broker. I would think so. At least ours came with our insurance broker. Yep. Her name is Monica. She is fabulous and
highly recommend.
Yeah, she's great. Anytime I have a problem with insurance, or maybe I'm not understanding something at the doctor, I'll message her and be like, Monica, are you free? And I can hand her the phone to the doctor or the receptionist, and she helps right on the spot. Yeah. My gosh, she is so helpful. And she did, I want to say she got us into her pediatrician that she uses for her children, but she was able to contact them on our behalf to get us a pediatrician seen right away before the school started, which was really important. And for me, I was so nervous because some of the platforms that they use here, they do not have like an online, it's not an online portal, or is it an online portal? Yeah. Yeah, but it's like the appointment system isn't active yet, or maybe the pediatricians won't allow you. You have to call in. Yeah. And I was like, I am not calling in. I am terrified to call in the beginning. So yeah, the insurance brokers are really, really helpful, especially ours. So hopefully you have the same experience too.
Yeah, we went with a private insurance, and Monica's great. Again, I don't know if I can link her information, but if anyone wants her information, maybe just like comment, email us, do something. Simplifyabroad.com. Send us a message. We'll just send her that information that way, just so she doesn't get spammed or whatever. But basically, when she had told us that 95% of people do not do the 15 visits. So like we were going back and forth, like, oh, should we get it? Should we not? She's like 95%. So even on top of that, she didn't even upsell us that. Like I can't remember last time someone didn't try to upsell me something like from the States, right? Yeah. She just told it to us direct, and like she said, I used the most. I used 6. Maybe one of our kids used 4 or 5.
A lot of ear infections.
Ear infections. Yeah. But to hop back to it, the next point I want to talk about is pharmacy prices. So. Don't even need an insurance card for some of these pharmacy prices. Obviously, you still need the doctor's note. You can't just like ask for something, right? But the best example I can give is my mom was visiting. She was short on her medicine, so she showed like a blood pressure medicine or something like that. Yeah. I think in the States it was like $40 was and I think with her thing it brought it down to like 15. or something. If you got the generic version or whatever, yeah, maybe 20.
Cheap,
yeah,
to be honest.
but she might have been on because she's older, like whatever that was. Long story short, the one here for 30 days was 60 days.
30
days.
30 days
Was $2.12. Like the same exact medicine, no insurance, no copay. Like I guess it is a copay if you buy it, but like there was nothing. Like there's no deduct. Like there's nothing you had to do.
Didn't even ask her for information because I did take her in there and I just walked up and I was like, hey, we have refills from the United States and we didn't get to be seen into a doctor. I'm like, can you refill this? And I just showed it to them and they're like, oh yeah, let me see what we can do. And they're like, okay, we'll give you a call when it's in. We're like, wait, we could do that here. This is normal. 'Cause in the U.S. you can't do that. You have to have a prescription or you have to have someone called in.
Hold on. To be clear, this is a minor blood pressure medicine.
Yeah.
Obviously, a major medicine you can't. I don't want you thinking like Spain just lets you do whatever you want. That's not true. That's not what we're trying to imply. Let me just be clear here.
That's true.
We're not implying that. We're just saying very minor medicine that she had a prescription from the U.S. She just showed it on her phone and they just filled it for her here. Yeah. That's all we want to say.
Yeah, that's true.
And really, it was $2.12 versus whatever she was paying back in the States. And I know it was more than. But yeah, so I'll kind of let Aubrey wrap up the last thing.
Last topic. So we've gone to a couple of doctors, and some of the doctors, I will have to admit, are not the nicest to expats.
One of the few cons about the healthcare system.
But I will say anyone who's actually dealt with the children have been very kind, very patient. I don't think I've had any problem, and we've been to specialists like podiatrists, the ENTs, like
the ophthalmologist.
The ophthalmologist, and everyone has been so nice to the children. I would say when we would go to the doctors, I don't know if they care for us, and maybe it's just the hospital we've been going to, which I'm not going to share that hospital in particular.
Probably changing. Our lady hates that hospital.
Yeah,
She's not. Our insurance broker is not happy with them.
They apparently have a lot of problems with the doctors and treating expats in general poorly. Yeah. And I will have to share just an experience that we went to the doctor in the very beginning. I want to say in the first 3 or 4 months we went to. And it was a specialist, and we went and we were like, oh, do you speak English? And we know she did because we got the referral. Yeah. From someone
who went to her and told us she spoke English.
And so we came in, she goes, and she was upset with the fact that we asked her if she spoke English being in Spain. And we're like, we understand, but we have something very important that we need to discuss with you, that if we were in the United States, we'd have a hard time discussing this in English, let alone now you want me to throw my Spanish in there. So she was not happy. Needless to say, we did still get the test ran, but we never went back because I was sweating. I was so nervous, and he doesn't care. He could care less the way people treat him. But I was like, oh my God, I can't do this. Like, she hates us, and I'm trying, and then I was just too flustered. It's just not for me. Yeah,
and again, I understand people being frustrated we don't speak Spanish. At the time, especially. Now, better. One, we mentioned this in the previous video. The terminology of Spanish, like medical terminology, is incredibly difficult. Like she said, U.S. terminology I can't even get correct all the time. So do it in Spanish. It's just not words we had learned at that point. And two, I do want to say, probably 80% of the doctors have been amazing to us.
Yes.
Probably there's really 3 doctors in particular. And really one of those 3 were really bad. And it's just this one that she's mentioning. She went out of her way to kind of blame us for not knowing Spanish yet. And that you're in Spain, you should talk Spanish. We were trying to, but she just, we're not going to get our point across. So at that point, I just resulted into the DeepL Translate app. I just spoke into it, showed it to her, and we went back and forth that way. She was very angry at even that. I thought that was actually a very good compromise.
But it's just very different.
Yeah. But again, 80% of the doctors have been absolutely amazing to us. I want to stress that very clearly. One in particular was pretty rough. I mean, she was pretty rude. Yeah. But she ordered the test that we requested. Our insurance paid for it. We didn't pay for anything with that. And
we followed up with a different doctor.
Who was amazing, read the stuff to us, and we got what we needed. Yeah. So, Yeah, I think the last thing, just to wrap this up, I would say you definitely want to, if you're not positive and you're like confident in your Spanish yet, we brought our babysitters with us, two ones that we didn't think were that important. Not like, obviously you have something very personal, maybe you don't want your babysitter to know, right, type of thing. You may have to hire like a professional translator. We brought our babysitter and let her handle it, basically. And it was a great compromise. She got paid. She did all the Spanish translations for us. We followed where we could. We told her what we wanted in English. She translated for us, spit it back to the doctor. Very cheap, very simple. If you're not confident and you're worried you'll be treated poorly, it's a very easy addition to like just bring a babysitter or something like that with you. And was it $10 an hour, $12 an hour? It was nothing. Yeah. So anything else? I think that's pretty good for healthcare. No,
I would say overall that the healthcare is very good here, and I will have to say, you know, moving here, I just would like to add this on. I had a lot of anxiety in the United States of every time someone felt sick, or even at night, you know, the kids were running a fever, or you know, just anything. I'd be like, oh, I don't know. You would waver, be like, is this an emergency? Is this not? Now I don't even think about it. Anytime anyone's like, hey, my ears hurts, because 3 of our kids have chronic ear infections. Then I'm like, all right, let's go, pack it up, we're going. And even if it's 12 o'clock at night, I'm like, we're going, doesn't matter, here we go. You know, anything. Yeah, it's just, I feel like that anxiety over the medical or being in debt, you know, because I mean, you can rack up bills for medical, you know. But not having that anymore is just like, it's just, I don't know how to.
No,
it's a weight off your shoulders.
Very simple. The peace of mind.
Peace of mind. There you go.
For example, like my appendicitis. If we were in the States, I for sure would have hit my deductible, and then I'd have to probably fight my insurance. Like where they're like, oh yeah, like, but you didn't have to get that. We're gonna pay for these 3 tests, but those 2 are overkill. These 3 should have shown already, so you have to pay for these 2 out of pocket on top of your deductible. Like it's, again, Americans get it, Europeans don't. We're now understanding it, we grasp it.
We've witnessed it.
Everyone deserves health care. I can't stress this enough. And Aubrey said it perfectly. It's a weight off your shoulders, it's a peace of mind, and if you're from the States, it's pretty wild. Like, to be honest, like it's just kind of wild. So other than that, I think that kind of wraps it up. So we will see you guys in next week's video.
Adios.
Adios.